Hi, I'm Dr. Sam. I'm a board-certified plastic and reconstructive surgeon, and today we're going to talk about Mastopexy augmentation. What is Mastopexy augmentation? That's where we take two of our more common procedures and put them in one. So Mastopexy, which means a breast lift, combined with a breast augmentation. So we're going to be lifting and putting an implant in at the same time. Implants come in all shapes and sizes. We have a couple examples here that you guys can see the difference. Most commonly are silicone implants that are used. Why silicone versus saline? Silicone feels a little bit more natural. It has less rippling, so looks more natural when you're looking at there, in addition to feeling more natural. And sometimes people feel like they're less heavy. The other thing is with the saline implants, some people can hear a little bit of motion sometimes based on what activities they're doing. So what do we do when we're doing a Mastopexy combined with an augmentation? We have to be careful when we do these because sometimes we have opposing forces as part of the surgery. Mastopexy, we want to lift everything up, but when we're putting implants in, that's creating weight against what we're trying to do. So that can lead to some increased scarring as there is excess pressure on the incision line, as well as problems with healing and sometimes even exposure of an implant. So if someone really wants to have a large implant put in, it's not the right procedure for you to combine these. We do one and then the other and you'll be okay. But in people that are more reasonable, we want to do smaller sizes. Someone that, for example, we're doing as part of a mommy makeover, they had a C cup or small D cup breasts, got pregnant, have had multiple pregnancies, the breast enlarge and atrophy, enlarge and atrophy, and then they end up with smaller deflated breasts. Then doing this lift and implant placement at the same time to get them back to where they were before is a reasonable thing to do. But if they wanted to be like a triple D, then we have that discussion and come to terms about what is the risks and what's the benefit of the procedure. So what does a Mastopexy entail? Typically we'll have our standard lift incisions, whether it's an elliptical incision with a lift around the nipple areolar complex. So it'll look like a lollipop incision in most of these cases. And then we go in through that same area, place our implant inside. The key to avoid excess scarring or wound healing problems is to really make sure you have covered the implant well with the tissue underneath it. So typically we'll make sure there's a good layer of coverage and we really have a strong closure before we get to the skin, because we don't want that pressure to lay on the skin, which is going to end up having wound healing problems and the scars widen. If you or a loved one is looking for this kind of procedure, give us a call. We're happy to go through and answer any questions you have. We're here for you.